when you develop schizophrenia, you drive off a cliff. So imagine, you could stop the process that's already underway. You're driving down the road toward a psychotic episode, toward schizophrenia, and you either drive off the cliff or you don't. PIER program focuses on the phase prior to the onset of psychosis with adolescents and young adults. Like other chronic disorders, there's a phase in which symptoms are developing. A lot of the disability occurs right around that time. If you can prevent the onset of psychosis, you may be able to intervene to prevent that kind of disability. And we're trying to educate as many people as we can, and certainly trying to educate everybody who spends a lot of time with adolescents and young adults.
My daughter was 14 years old. She was becoming paranoid, thinking people were talking about her. She'd be up all hours of the night. And it just got to a point where she couldn't verbalize, she couldn't speak.
She had some signs of early schizophrenia, which was probably the most frightening thing I'd ever heard.
This is nobody's fault. This is something that's happening in the brain. Treatment used to be not family involved, and now what we know about family involvement being so important, we have a team approach in working with families.
And he's going to be able to take care of himself.
Okay.
Our multifamily group allows them to connect with other people that are having a similar experience.
We intervene at the brain level with medication. We work with the family to change the immediate psychosocial environment. We work with the school to alter the educational program so the person can both stay in school but also keep up.
When you hear the stories from adults who were sick for a very long time before they got the right kind of help, it feels very hopeful to be working in prevention. It just makes so much sense.
Good. Is that?
I'm just so thankful that it was, and grateful for what they did for our family and gave us our daughter back.
We know that youth and young adults are not calling on the phone these days, they're texting. And so what we did is set up a texting service that allows for students in crisis to be able to access a counselor. The texting service has volunteers, interns, and paid staff who all answer texts of people who are in crisis. Immediate crisis with concerns like suicide, other mental health issues, and who might be concerned about a friend who is in crisis. Previous to Text for Life, the National Suicide Prevention Lifeline call number was only getting about 5 to 25 calls per month from youth and young adults around the entire state of Minnesota. That increased within the first 2 years to 300 youth and young adults accessing Text for Life every month. And now with the additional regions that we've expanded to, our average monthly text conversation rate is almost 1,000 per month.
The problem in San Francisco is that we lack a coordinated system of mental health care that meets the needs of people who are either in the criminal justice system or are at risk of becoming involved in the system due to untreated mental illness. The Behavioral Health Justice Center would provide different levels of care for the wide array of mental health, physical health, and substance abuse issues that we see in this population. And it would also address people who are at risk of becoming involved in the system when they first encounter the police because they're in mental health crisis. It would help treat people all along the criminal justice continuum, all the way through successful reentry in the community. It would be the first of its kind in the nation, and it would bridge the divide between mental health and criminal justice. Right now, we have a population of people who cycle endlessly through the jails, the streets, and psychiatric emergency services. It's a public safety as well as a public health crisis. It's not humane, and it doesn't have to be this way. We need to close the gaps, and a single facility dedicated to this population would do just that.
We find ourselves in the middle of a crisis in our community with behavioral health and substance use disorders both virtually rampant, and we don't have a system in place to solve it. We have to create one. Our solution is threefold. One is to really build and strengthen the community collaboratives that are in place. We work constantly with the police department, the fire department, the courts, the corrections, the school system. We meet on a regular basis, and we talk not just about the clinical aspects of behavioral health and substance abuse, but what do we need to do for the community to make it easy to choose not to go down that path. From a treatment standpoint, what we have done in our emergency department is to hire a group of behavioral health and addiction specialists. And we've embedded them in our emergency department 24/7, so that if a behavioral health or a substance abuse suspected patient comes in, they are medically screened and then they are psychiatrically screened, and we try and get them into treatment as quickly as we possibly can. We have aggressively moved to try and actually develop a behavioral health treatment system here in the hospital. It's been successful. In just 6 months, we were able to finally start the program, and in that short period of time, we've already opened up over 1,000 new patient records on this population. And just in this organization, in a very brief period of time, we have found a 25% reduction in the number and amount of prescription opioid that comes out of our ED.